during this pandemic. So far, 2021 has proven to be just as challenging as 2020. We want to highlight and encourage authentic, effective, and sustainable collaborations for the public good. As UNC-Chapel Hill and communities throughout North Carolina have adapted to the impact of the COVID-19 pandemic during a year that showcased ongoing racial injustice and controversy surrounding our election, we seek to highlight the ways that university and community partnerships have evolved over this time together. I want to remind folks to go ahead and mute your line or silence your line if you're not speaking, so that we don't have the background feedback. If you remember last year around this time, our Connect, Engage, and Transform, or CET for short, was originally an in-person conference hosted for the very first time at the Friday Center, organized by the Carolina Center for Public Service and UNC Rural. And UNC Rural at that point was a brand new entity on campus. And last year's conference also focused on university community partnerships based in rural North Carolina. We had over 250 people attend that session and that conference, and we are thrilled to have had a lot of positive feedback about participants' experiences, their ability to connect. And we realize even more so now we need that way to connect with each other. So we've designed this series of webinars to keep the conversations going and to check in with how these very same partnerships, some of which actually were established during that conference, have adapted to the pandemic. Today's topic is partnering for food security in the pandemic, and I'm excited to introduce the Carolina Center for Public Service Program Officer for Community Engagement, Kate Palmer, who will introduce our panelists and moderate the session. Kate manages the Buckley Public Service Scholars Program and advises the SMART Mentoring Program and coordinates disaster relief efforts for CCPS. She has a bachelor's in psychology, a master's in social work, both from UNC, and brings an empathy-centered perspective to her work. Kate, thank you so much for leading today's session.
Thank you, Giselle. So we're so happy to have all of you here with us today. I think there's too many of us to go around and introduce everyone, but if you all want to drop in the chat what county you're from, so maybe we can get a sense of different counties that people are from, if there's some connection there as well, since we don't have the time to go around. And I'm from Durham County, North Carolina, so. And if you're not from North Carolina, you can also drop your county and state. Awesome. Well, I'll keep us moving while y'all are sharing that information. Just know you can reference that to find out some more information about where people are from. But welcome to this webinar. I'm going to introduce all of our panelists and then we'll get started. Sherry Hay serves as Director of Community Health Initiatives and Adjunct Assistant Professor at UNC's Department of Family Medicine. In her role at Family Medicine, she works with a variety of the department's community health programs, from helping the uninsured gain access to primary care, helping the healthcare system develop a process for ACA enrollment, to wellness programs with the town of Chapel Hill. She was awarded the Hometown Hero Award for her work on these programs. And Hay has a bachelor's of social work and a master's of public administration from UNC Greensboro. Prior to joining Family Medicine, she served as the Director of Integrated Health Management for the North Carolina State Health Plan. She also worked at the Office of Rural Health and Community Care, Division of Medical Assistance, WellPath Community Health Plans, and served as a national consultant with the Commonwealth Fund. When Yulani Padilla started high school, she knew she wanted to be just like her mom and be in the medical field. During her second year of high school, she heard about the nursing program. Her senior year, when it was almost time to take her exam to become a CNA, she studied super hard and practiced all of her skills. And when it was finally time to take her exam, she failed, but she did not let that stop her. A couple of weeks later, she retook the exam and passed. After graduation, she worked her first job at Food Lion. She applied for nurse technician positions in the hospital and environmental services, but had no luck. She almost gave up, and then an opportunity to be a community health worker came in. She studied a book on roles of community health workers and started working for a program called Care Connect as a community health worker in March of 2020 when the COVID-19 pandemic just started. She has grown and learned so many more important skills and developed a humility that she can't describe. She is proud and very honored to have gone through what she's gone through to become the person she is today. Victor Johnson has a diverse background. He worked in law enforcement, was the public safety director at multiple large shopping centers, and was the senior captain of field operations and security at High Point University. He also earned an associate degree in funeral services from Fayetteville Technical Community College and spent several years in the funeral profession. He holds a current North Carolina funeral director license and earned a bachelor's degree from Liberty University in interdisciplinary studies in religion and law enforcement. He's currently the cafe manager for Lot 2540 and the interim program director for Rockingham United, the mobile market. He has a passion for helping others in the name of Christ. And then our final presenters will be Dr. Alice Amerman and Eleanor Wortman. Dr. Amerman is interested in design, testing, implementation, and dissemination of innovative clinical and community-based nutrition and physical activity interventions for chronic disease risk reduction in low-income and minority populations. She's the director of the UNC Center for Health Promotion and Disease Prevention, part of a national network of 26 CDC prevention research centers that work with community partners to identify public health problems, to develop and evaluate prevention-focused public health interventions for wide dissemination, particularly in underserved communities. Her research addresses the role of sustainable food systems in health, the environment, and economic well-being, emphasizing the social determinants of health, particularly food access and food insecurity. She is also the Mildred Kaufman Distinguished Professor in the Department of Nutrition. And then there's Eleanor Wortman, has her Master's of Public Health from the Gilling School of Public Health at UNC, and is a Community Health Program Manager at UNC Health Alliance. She works with UNC health patients and their communities to address social influences of health, how social and environment factors like income, housing access, and access to nutritious food affect health long before folks even see a doctor. Her plan for spring and summer of 2020 were to do home visits, but after the COVID-19 pandemic hit, she reached out to Dr. Amerman due to her work in food insecurity. She realized that in Chatham County, Latinx and Black communities were being hit disproportionately. So the Center for Health Promotion and Disease Prevention and UNC Health worked with Chatham County and the North Carolina State Extension partners to create a one-stop food hub at Bray Park in Siler City. So without further ado, we will first hear from Sherry Hay, Yulani Padilla, and Victor Johnson, if we can hear from you all first.
All right, well, good afternoon, everyone. I'm Sherry, and I appreciate, and our team appreciates this opportunity to share the lessons we've learned and look forward to learning from you as we build out food opportunities for people in our communities. We wanted to give you an insight into our project through pictures, stories, videos, and also some data. So that's where we thought we would start. You heard a little bit about each of us as members of this team, and we're going to just bounce back and forth in terms of the presentation. So Dane, if you will, next slide, please. We thought it may be important as we talked a little bit together about Rockingham County to give you some insight into where it's located. If you'll see from the arrow at the map at the right of the slide, Rockingham County is in the northern Piedmont region of North Carolina. You see the population's a little less than 90,000. And the other data is indicative of health status. About 13.2% of county residents under 65 are without health insurance. So that is, for context, above both the state average and the national numbers. 18% people live in poverty, and the per income income is about $22,000. You'll see a little bit in the last bullet about the rates of chronic disease, in particular heart disease, diabetes. When compared to state averages, Rockingham County has the lowest rate of primary care physicians per 10,000 at 4.7, compared to a state average of 7.6. Next slide, please. So during a span of time that actually started about 2 years ago, so pre-COVID, a group formed to look at some of this information and data around how we began to think as a community to address access to primary care. That group is a multidisciplinary group. We have between 35 and 40 partners that are a part of that group. And during the initial months of COVID, that group, which is called ROC PCI, and that's short for the Rockingham County Primary Care Initiative, came together. And we knew we still needed to address the issue of access to primary care, and that was key for the community. And we had together done a number of interventions that we're proud to say as a team were successful. But we also realized that COVID presented some real issues for the community that we needed to begin to think about. So as a group, this consortium, the ROC PIC consortium, said, let's take a look at those issues and prioritize them. So through a priority mechanism, food insecurity was identified as the #1 need in the county. And we got the notice of the grant from UNC Rural, and we, along with other partners, new partners to the group, like Lot 2540, said, let's just do it. Let's jump in. We know this is a major need for the community. We have our partners at the table, and let's think about how we expand to offer this important service. So we were fortunate and very appreciative to receive the grant funds, and we identified that we wanted to offer mobile food markets to 2 underserved zip codes in Rockingham County, collect health assessment data to better understand the needs of the populations. So not only address the issue of food insecurity, but then say, how can we support individuals that come for good, healthy food around their other health needs? And then the goal was to really build on an existing model that was proven and it has been working, but to expand it into these new areas that were identified as high need areas. Next slide, and I will pass it on to Yulani.
Hi everyone, my name is Yulani Padilla, and I'm with Care Connect Cone Health. And so here's the health assessment that we used for our mobile food market. So we collect information as far as primary care doctors, if they have insurance, if they use internet or social media in any kind. What we do is, as Care Connect and me as a community health worker, I reach out to those people who don't have insurance because our program.
My afternoon snack of a cookie.
I'm sorry, let me regroup really quick. So we help people of Rockingham County who are uninsured get a primary care doctor. So these health assessments, we are out there in Rockingham County and we get our information as well. We call, we text, I go out into the community and I just see if they would like to be part of our program. Next slide, please. So this is some data that we've collected from the health assessments, the mobile food markets. And as you can see, 39% have no insurance. And when we get these health assessments, I usually get in contact with them and explain our program. And of course, I talk to them about other food resources that we offer. We have toiletry here at our clinic. I help with a lot of things like taxes and all that good stuff. I help them get insurance, file for disability and all that good stuff. And yeah, and also the internet access. I believe that's a really big a problem with Rockingham County. I'm not too sure why, but we also collect that information for the mobile market, so we could see how we could get in contact with people if we need to pass out, mail them some information of food or whatever needs that they need. Next slide, please. So we offer 8 new markets. We served over 300 and over 2,700 pounds of food, which is awesome. Let me just tell you that now. And our program is faith-based, so we go to churches or and just do our mobile food markets. Some of the churches, for example, Madison, there is a church that they give volunteers and they help us with our mobile food market. We also have people from Strong Minds, Strong Communities, and their behavioral health program. And they also hand out their own flyers and they explain their program. And we also explain our program as Care Connect. And the data that we collect for our project is for grants and more opportunities to get more resources to go out there in Rockingham, because I know more of Rockingham is in need, like for example, Eden and Stokesdale, Stoneville, those out there. So we're just hoping that we can get out there and reach more people for their needs. And next slide, and I'll pass it down to Victor.
Okay, I'm sorry, I was trying to unmute. Good afternoon, everyone. Again, I'm Victor Johnson. I'm with Lot 2540 and Rockingham United, which Lot 2540 is basically the parent organization over Rockingham United and the mobile market. As we already talked about, mentioned the volunteers. Just this slide here, volunteer heard about Care Connect through this project and expressed interest in learning more about the program, now serves on the advisory board. So we are expanding out into the county, and people are learning more about the program, which is great because we're trying to expand the program throughout the county. We already talked about the Caswell Health program, how it was kind of brought on board or learning from our program as well. Conducted outreach to people living with health concerns, as already mentioned. And we did have a part-time mobile coordinator, which went on to get full-time at Caswell. That was Beryl. My position was also created through the mobile market. I was the cafe manager there at Lot 2540. Just tell you a little bit about that. We serve a hot meal to anybody that wants it Wednesday through Saturday. And I kind of took on the role as an interim program director. I have now, since they have given me the position full-time, so I'm now the full-time program director for the mobile market. If you move to the next slide, please. So this is just one of our volunteers, but let me tell you a little bit about how the market works. The mobile market was already in existence prior to COVID. The clients used to be able to walk through the market, select items that they chose to, that they wanted. So dry products, we have a freezer and a refrigerator on the market, the truck, and they could walk through and get the items that they want. So if they didn't want soup, they didn't have to take soup. If they wanted this meat instead of that meat, they could choose it. Now, of course, with the COVID, it's a mobile market, and that's what these programs were about. But the two main areas that was set up through this grant was Monroeton area, and that's where this gentleman's from too. We'll play the video here in a minute. That's a brand new market. Those churches come on board tremendously fast. There's 5 churches in that market, in that coalition, and that was one of the fastest ones we put together. The other one was in Madison, Mayodan, and as already mentioned, Fountain of Youth Ministries was one of the volunteers that came just about every time we had the market. Well, we tried to build a coalition for the cost and to cover volunteers after the grant expired. And I'm happy to say that we have 4 new churches that have come on board and has taken on that market. So that market will continue. The Monroe market will continue. We have markets in Williamsburg. We have markets in Shiloh, We have market, again, Madison Maidan. So it's expanding. It is well worth the time and effort and the money put in. Just to give you a real quick story, we had a gentleman at the first Monroe market that this gentleman was probably 30 some years old. And we give out bread and dessert. That's what's one of the items that's packaged that we give the clients. And I know how many cakes were in that dessert because I packed all 60 of them, all the bread and dessert. There was maybe 3 full-size cakes that we get donated to from Food Line. And that, so there was maybe 3 in the 60 that we had. When we was distributing the food, he was one of the last ones there, and he ended up getting one of the birthday cakes. He just happened to see it as it was being loaded up in his car, and he turned around and he was just so thrilled. I know this is a little thing, but to me, it's a God moment. He was so thrilled that he got a birthday cake on his birthday. It was his birthday that day that he was getting the meals. So, I mean, it's a small thing, but what you've helped us accomplish through this grant is a huge benefit to the individuals in Rockingham County. And as we say, we continue to go. We're trying to build it in the Wentworth area, Ruffin area, and Bethany area. And this gentleman here is Wayne on the video here. He's just one of the church volunteers, and we can go ahead and play the video and you can kind of hear his story.
Why did you choose to come out and volunteer today?
You can't reach a person's soul till you feed their body.
What do you expect to happen today?
I expect to see people go away from here knowing that someone truly cares for them.
I think he hit it right on the mark at the end, that we want people to know that we do truly care for them. It is not just about the food, but it's about building community. That's why when I go out, it is not me at the Monroe Mobile Market. I'm not going to be in Monroe community. These people are in the community. They're going to build the community with the individuals in that community. They know their neighbors. Matter of fact, the last market we had in Monroe, we had a gentleman checking people in. He knew just about every single person that went through the line. That's where we build community. That's where we build relationships. And that's how we can try to get some of these people out from under the condition that they're in. I just, again, want to thank you all. It was a joy working with everyone, Sherry and the Care Connect, Ulani, and it has been a blessing to work with you all through this grant. Thank you all very much.
Thank you all. We appreciate y'all taking the time to share with us a lot about the importance of community building and relationship building when it comes to that coalition work. I also want to remind folks, well, not remind because I didn't say this at the beginning. If you have any questions, please feel free to put them in the chat box and we'll try to address them. There'll be some time where you'll be in breakout rooms and you can think of questions to discuss. But if you have any questions, please feel free to drop them in the chat box. Looking at time, I think we'll move on to the next presentation just to be mindful of time. Once again, thank you all for presenting this work with us. We love hearing about the importance of community and the backgrounds and the expertise all of you have brought to this work and how you're really committed to the sustainability of everything. So next we'll hear from Eleanor Wortman and Dr. Amerman.
Hey everybody, can you hear me and see my slides? Okay, thanks, got the thumbs up from Kate. So I'm Eleanor. I'm going to be presenting, because we have a lot to cover, I'm just going to go through everything quickly, and Dr. Amerman will be cheering me on from the sidelines, but she was absolutely my partner in crime in all of this. I'm here to talk to you guys today about the Chatham Food Hub, and thanks to that lovely introduction from Kate, you heard a little bit more about how I came to be involved in that project, but essentially this was a COVID relief effort designed to focus on addressing both food insecurity and the economic impact of the COVID outbreak. My work is focused on addressing patient social determinants of health within the UNC health system. And so as soon as the pandemic started, it was clear there were going to be issues with food insecurity. So I actually emailed Dr. Amerman out of the blue saying, hey, what ideas do you have for working on food insecurity? What started off as a conversation about connecting UNC hospital employees with produce pivoted to how do we come up with a more direct community response to COVID-driven food insecurity? How do we come up with something that'll help keep these local businesses open and feed people? And could we do something in a nearby county that's a little bit less affluent than the areas where we live in the Triangle, but is not too far away? Dr. Amerman's initial idea was to establish a food hub, which is similar to an existing hub called Carver United, but based in a more rural and less affluent area. And we quickly decided to focus on Chatham County because we have a UNC Health presence there. Both Dr. Amerman and myself have partnerships with existing community organizations there. It is a rural area and it's relatively close to where we live, so it makes coordination a little easier. And so we started applying for funding opportunities in April to support this idea. So just to give you a little bit more details about the food hub model, so this can vary by food hub, but our food hub, the idea was each week, businesses that are participating as vendors add meals and farm fresh produce items to a menu. Customers then have a number of days to order their items online. And then the following week, businesses prepare their orders and bring them to a pickup site once a week, and they're stored on a refrigerated truck for pickup. Our customers drive through or walk through the pickup site, and employees who we hired from the local community hand out the orders. The win-win here is customers get local food and businesses enjoy more sales. So that was the initial idea that we had that we sort of brought into our funding application. We then wanted to narrow our focus to a specific geographic area and quickly settled on Siler City within Chatham County. Chatham County is a really interesting place because it really does have a financial divide. Even though it is relatively affluent compared to some rural counties, there are areas that are not. And in fact, Siler City's median income is about half that of the county overall. Additionally, Siler City has significantly larger Black and Hispanic or Latinx populations than Chatham County, which is important because these communities, due to structural discrimination and many other structural factors, tend to have worse overall health, experience more poverty than white non-Hispanic counterparts. And as a result, unfortunately, are at higher risk for COVID. And indeed, Hispanic people have been about half of the COVID cases in Chatham County, despite being only about 12% of the population. And by early May, we are already seeing that Siler City had the second highest per capita COVID rate in the whole state. They also had the 14th highest rate in the state as of October. This is driven, again, by some of those structural inequities I mentioned, but also the fact that a big part of the industry in Siler City is meat packing. There's a meat packing plant for poultry and for pork, and both of those are huge employers and actually pay better wages than many. So that is a huge driver as well of the COVID cases there. So that drove us to focus on Siler City. So in the midst of this and applying for funding, we started to get the team together really with a focus on having this be a community-driven effort. We hosted a kickoff meeting with about 40 community partners from across the county to get some initial reactions to this hub idea, with folks from local nonprofits, local government, local food banks joining us to weigh in on, like, is this feasible? Is this something you want? Is Siler City the right place to do it? And the answer to all those questions was yes. So by May, we had formed these operational work groups with our community partners to sort of get the planning going. The names are pretty self-explanatory, but community engagement is about getting the community involved, getting more buy-in, getting customers, getting media coverage, funding and logistics, just what it sounds like on the tin. How do we pay for it? How do we logistically coordinate all of this? And then safety and compliance is focused really on two different things. The first is, of course, minimizing the risk of COVID infection and protecting people on site as they drive through to pick up their orders, but also food safety was another focus. We also, in addition to getting these groups going biweekly over webinar, we identified some wonderful, wonderful folks from Chatham County to be our kind of operational leads on the Chatham side of things. So Hillary Paulin from the county manager's office and Tara Gregory from the Chatham Public Health Department both signed on as our project co-leads. They co-facilitated our working groups and were really our go-tos in between meetings to say, you know, who do I call about getting a permit for this? It was hugely, hugely helpful to have them involved. We also were fortunate to have student engagement in this project. We had an undergrad team and an MBA team that were both helping with market research, looking at other hubs, and providing advice on vendor selection and sustainability. We had some nutrition students through Dr. Amerman help develop a customer interview guide and interview customers on site, which I'll talk about in a bit. We had some law students help with a nonprofit incorporation application, which again, I'll talk about in a little bit. And all of our students, except for the law students, participated in a really lovely Welcome to Chatham County orientation that our Chatham County community partners led to really introduce people to the county, the makeup of the county, the sort of different communities living there, the strengths and challenges that Chatham County faces. So it was a great introduction and a great way to work with students, I think. We wanted from the beginning to be sure that we were tailoring the hub to the specific needs of Siler City, because again, it really is a unique place within Chatham County. We knew that Spanish language access was important, so really made an effort to translate everything. We also wanted to be cautious about privacy protections and attitudes to law enforcement for folks that maybe have mixed immigration status. So really minimizing data collection and creating a low barrier to entry for people to access the hub. We wanted the hub to be somewhere that was accessible and familiar to the whole community. So not, belonging to anybody. And that was how we landed on Bray Park with input from the community work groups. We also wanted a range of affordable options, from the free emergency food boxes that we offered through the Cora Food Pantry, which you see pictured here, to items that were slightly higher end, family meals for 4 people from the Root Cellar in Pittsburgh kind of thing. There were a few places where we were not able to be as accessible as I would have liked. All of these kind of related to the ability to order without prepaying, because we wanted everyone to prepay with a credit card at the end of the day, because we were worried that if people paid with cash or SNAP, EBT, and did not show up on site, then there would be a need to eat the cost of that purchase, and we just did not have the budget for that. And also phone orders, we just didn't have the staffing. This is a good time to mention that we had initially planned on funding this with a $100,000 grant, which we did not receive, and we found out about that in June, so well into planning. So we were working with a significantly reduced budget. So there were some things that we had to compromise on, unfortunately, that made, I think, the hub a little bit less accessible to folks. And I'll talk about that more in a bit. Engaging vendors was, of course, critical. These are the folks that were offering things for sale through the hub. We chose these people through community work group input and input from our students about who are the vendors in Siler City and beyond. Because we were immediately seeing during the COVID response that there were significant race and gender discrepancies in federal aid allocation, we really wanted to prioritize engaging vendors who are women and minority owned. Some barriers we immediately ran into were the fact that these vendors had already been losing money by the time we were able to operationalize the hub, which essentially just meant that some of them had less staffing and couldn't take something like this on. And then also a lot of our farmers were already well into the middle of their growing season, so kind of had already allocated all their produce for sale. However, we were ultimately able to engage 10 wonderful vendors, many of whom's businesses or themselves are pictured here over our 11 weeks of hub sales. We had 5 restaurants, 2 of which were owned by women, 2 of which were owned by Hispanic people, 4 farms, 3 of which were women owned, and 1 of which is owned by a Black woman veteran. And of those two of those farms were totally new businesses that had been trying to get started in April. So it was a nice time for them to step in and have this additional sales opportunity. And then of course we had Cora Food Pantry, which I mentioned, which was offering those emergency food boxes for free through our online ordering platform. Launching the hub was quite a lift, as Dr. Amerman knows. Spent a lot of hours on the phone with folks. We had to, of course, confirm the location, but that also involved securing permits through Chatham County and Siler City and getting on-site refrigerated storage, which was quite a challenge. We also had to create essentially a formal business infrastructure, from our online ordering platform to getting us set up as a nonprofit corporation, which was really necessary so that we could set up a bank account. And we also needed to hire staff. We had a hub coordinator about 20 hours a week, providing sort of day-to-day vendor coordination. And then we also had employees that were helping on site during order distribution days. And we hired all of those people from Chatham County and as close to Siler City as possible. Really, again, trying to make this an opportunity to infuse as much money into that economy as possible at the individual and business levels. And we also formalized our vendor participation agreements through a signed legal agreement. We were fortunate to get pro bono legal help from Brooks Pierce. So thank you to them for doing that, so that everybody's expectations were clear. That was where we laid out that all of the money from hub sales was going to go directly to the vendors, including tax, which they were responsible for paying. So this was just sort of all starting to take shape, which was really exciting. And then the last piece, of course, is publicity. You'll see our logo throughout, which the CHI core team at UNC designed for us. We also hosted our website on the Chatham Health Alliance webpage. Chatham Health Alliance is a coalition of different groups across the county that are focused on health promotion, and they were kind enough to let our website live with them. So that reduced our costs, because again, we had that grant funding issue. And also it meant that people were already on the website looking at other things and could see more about the Food Hub. We also set up a Facebook page, and then the screenshots on the side of the page here you'll see are some of the blog posts that our community partners did to help spread the word. After all of that, it was really a fire drill all summer, and then our first distribution day was on August 5th, 2020. This is my favorite slide because it gives you a sense of what it looked like on site at the hub. On the left-hand side, you'll see some images of our refrigerated truck, what it looked like inside. We had the Know Your W signage everywhere, so hopefully Dr. Cohen would be happy with us. Folks could drive through and pick up their items. In the top right corner there, you'll see our hub coordinator, Martha, who is organizing orders, and then in the foreground, the free cloth masks we were able to give out. So it was really quite a production and pretty spectacular to see it happening once we finally got it up and running. Of course, we immediately wanted to look at which customers we were engaging, and what we saw was a divided customer base. The customers that were getting the free Cora food boxes were a less consistent group coming through, but there were far more of them, whereas we quickly developed a smaller core base of customers that were paying for food, and they actually came back week after week, which was really neat to see. One thing that really helped be a mechanism for increasing paid orders in this relatively low-income area was our pay it forward donation option on the online ordering site. That just allowed people, as they were placing their order, to chip in $5, $10, up to $50 to help support the purchase of meals for additional people in Chatham County. So we would turn around and use that money to buy additional food from our participating vendors. And then I worked with Tara Gregory, who I mentioned before, and the nonprofit partners to match those donated meals up with individuals. So you really had this nice synergy of helping support local business, but also helping feed local people, which is really appealing to folks and actually generated a lot of interest from faith-based groups. We had a number of churches get us some pretty hefty donations to buy food for people, which again, helped increase local businesses' sales, helped feed hungry people. It really was a win-win and really exciting to see. Customers were really happy with the hub. We had a lot of trouble getting phone interviews going in Siler City for a number of reasons that I'd be happy to talk about more. But we ultimately landed on in-person interviews with some of our most frequent customers. So we had our nutrition students help with that. And the folks that they were able to survey said they really appreciate the convenience, the COVID safety precautions, and the opportunity to support small businesses, and said that they would spread the word to others. And in fact did. We saw many referrals from their friends. And then outside of the survey, we also got feedback from customers that it would have been nice to have the hub at a second location, which was higher income and would generate more traffic, which I agree with. But as I'll talk about in a bit when we talk about sustainability, financial reasons just made that impossible. Despite our extremely limited budget and our scrappy team, we were able to achieve, I think, some really exciting outcomes. We generated well over $8,000 in revenue, which again, all went directly to our vendors. We paid over $7,000 in wages to Chatham County residents. We donated 862 servings of prepared food to food insecure Chatham County residents. Often meals had multiple servings in them because there were a lot of family-sized meals. So that was really, really good to see. We distributed 220 of those Cora food boxes to 100 unique individuals, distributed over 300 masks. And I mentioned the Chatham Health Alliance earlier. They have this great group called the Resource Hub, which travels around the county giving out free items like masks, med disposal kits, and things like that. And we were able to host them on site 5 times so folks could drive through and also get, free backpacks for their kids and things like that. So that was really nice partnership there. We also have some intangibles that I think are a little harder to measure, but still important. One of our new farmer vendors, brand new, was able to double her social media following after starting to participate as a hub vendor, and actually got so many orders and so much interest that she had to drop out of participating in the hub so that she could focus on launching her business. We had one restaurant vendor book a catering gig from a hub customer, and another of our vendors is currently partnering with Dr. Amerman on a separate project. So that was really exciting, in addition to bringing the community together to generate ongoing business for folks outside of the hub. I think was really nice. We learned a tremendous amount from this. I think anybody that's ever worked in public or community health knows this, but it's important to reiterate that it's so critical to identify and really use your local leaders and resources and infrastructure. Like I mentioned before, the Chatham Health Alliance was gracious enough to host our food hub site on their existing webpage, which saved us money and helped increase our web traffic. The local nonprofit called Chatham Trades hosted that hub coordinator on their payroll so that I did not have to set up a payroll, which was hugely helpful. The North Carolina Cooperative Extension and the Health Department used existing meetings to recruit vendors. That was really important because business is still done in Siler City, face-to-face, pandemic or no. And I live far enough away that I could not get out there and meet with all of these people. So we had folks using their existing meetings, their existing inspection conversations to really encourage vendors to participate. The messaging was coming from a trusted partner rather than me, some random lady who they've never met before. And I do think that that was hugely instrumental in engaging vendors, as well as having that messaging coming from an existing trusted partner. And then the health department was kind enough to provide us with a ton of free masks, which we gave out to everybody, and hand sanitizer, which was nice. Because again, finances were an issue throughout this entire project. So we were trying to run as lean a budget as possible. I would also say that local government champions, again, no surprise to many of you, but they're critical. They really helped us a lot with things like permitting, things like food safety and inspection, and really just made things so much easier to figure out, especially at distance. Also, working with businesses is critical, and working with organizations who are dedicated to promoting business is critical. The Chamber of Commerce and the local Visitors Bureau contacts were so helpful in publicizing this and getting us set up as a County UNC business, letting us be a member of the Chamber of Commerce for free. So such helpful partners, such nice folks. I think another thing that was really humbling to me to learn was how much people want to help and how much people were grateful for the opportunity to give back. I heard that a lot from the Pay It Forward donators and from the partners that were engaged most heavily in planning, is that I felt, you know, I had a hard time asking for their time because they were very busy, but what was clear was that they wanted to help. And the last thing I'll touch on is just that COVID and crisis fatigue are real. It required constant reinforcement to remind people, you know, safety precautions are still important. Yes, we are still doing the hub. Yes, you know, we do still think it's important to have this COVID-friendly way to shop. So I know we can all relate to COVID fatigue at this point. As I mentioned, funding was short for us. We were not able to sustain the food hub on an ongoing basis, which is too bad. But I do think that if anybody else is interested in this kind of project, we learned a lot that will hopefully be helpful to them. The first is, I think if we'd had more money, it would have been great to diversify our customer base by offering the hub in multiple locations, which would have allowed us to charge our wealthier customers essentially a surcharge for the convenience of participating in the hub, which I think our wealthier customers in Siler City would have been willing to pay. There just weren't enough of them. That would allow us to subsidize things for lower income customers. I think it would have been great to explore, you know, what happens if we subsidize things like fresh produce. I would have also liked to provide financial incentives to early adopter vendors to get them on board faster and help cover kind of that startup cost of needing to have staff to prep the food for the orders. It would also be great to build an additional value adds for participating vendors. Our student research found that many food hubs, because that's not a new concept, do things like store produce on site for farmers. So kind of making it an additional support besides just a place to sell, helping them have a central location to come get their stuff and take it out to farmers markets. I think also if we had had a higher sales volume, we could have started charging our vendors a participation fee to be involved, which is how many hubs sustain themselves, although many do still require grant funding. And the last thing I will say is just not underestimating the need for paper-based marketing, especially in areas with less internet access like Siler City. I think all these rural-oriented folks are well aware of that, but it is helpful to go out there and stick up some flyers sometimes, even if your social media presence is perfectly fine and people are engaged there as well. I can't give a talk about this without spending some time thanking all of the Chatham County partners that made this happen. I can't even tell you how many people stepped up to help with this project, but the folks listed here are the organizations that were particularly helpful. I won't read them, but they were so helpful. I want to thank Dr. Amerman for responding to my email and committing herself to a summer of craziness on top of everything else she was doing. Thank you for that, Dr. Amerman. Thank you to the UNC Rural and the Health Foundation for their funding support, and to Jamie Louder, Mocha Brooks Pierce for her pro bono legal help. And thank you to you all for listening to me talk about this project today. I look forward to discussing your questions in a breakout session, and just wanted to finish with some more photos from the hub in action. Thank you guys so much.
Thanks, Eleanor, and to Dr. Amerman. It's wonderful hearing about a project from the very beginning and hearing how it all came to be, and just how you all have shared lessons that you both learned that can help other folks when starting to do this type of work. And just the importance that both of our groups shared about finding the local champions for the cause, I think is really important. I think you can't get anything done without doing so. So next we're gonna have breakout rooms where people can share, introduce themselves to one another, an opportunity for some networking, but also to come up with some questions that you would have for our panel. And so we're hoping that Dana will probably separate you all into groups of about 3 or 4, and then folks can discuss what questions they might have, and then we'll come back to the large group and you all can share any questions you might have for our panelists who have shared so many wonderful things with us today. Everyone is back. Thanks y'all for participating in these discussions. I think now we have some time that if in your group, anyone had some questions for our panel or had some specific things that they wanted to share, that came up in the discussion group, this could be a great time to really share and network and talk. So leaving the floor open for folks to unmute and share.
This is Maureen Berner, and I'd like to share from our group. We had a question for the panelists, and that was to really, what would you take away from the examples that were provided that really stood out as keys to moving these models into something that could be implemented in other communities? Especially the food hub, you know, it appeared to be quite a lift. And what lessons would you step back and honestly say, sort of like, if there was one thing that really sparked the idea that could be generalized to other places, what aspect of that, or of the mobile markets, would come out of it?
I think for me, the appeal, especially among these faith-based communities, which are really willing to open their wallets and support the hub, it was the idea that it was not just giving money to charity, it was also supporting a business. I think there's that sense of wanting to support those dual goals of economic development and addressing food insecurity. That was really appealing for folks, but it's not always easy to explain, and it can make it much more difficult to get grants if there is somebody that's like actually making money off of this thing. So I think some of it is finding the right funders, because I do think there's more of a shift towards wanting to support, you know, businesses surviving through COVID. I hope that's true.
I think this is Sherry. I think one thing that I've learned through the mobile market opportunity is just the richness of relationship, and building upon an existing model also helps with sustainability. Because I think sometimes communities are reluctant to try something, invest in it, but if they see it in a small version in action, then they may be like Victor described with those churches. See, without the funding, would we be able to sustain it? Well, they saw it in action and they started participating and then invited others to participate. And I think in seeing it, participating, they felt and saw the fruits of their action, and now they're willing to sustain it. They said, we will pay for it now. So I think that was something that I hadn't thought about until we were talking about what we learned as a small group from our project.
Yeah, just to add on that, this Victor, a lot of these organizations or churches that I reach out to want to do something, but they feel they can't do it on their own or by themselves, or they don't have the resources or they don't have the funds. But when you put them all together, then they're more apt to go out and do something because they know they have a partner, they know how they have additional people to help them versus them trying to do it alone. Some of them I spoke to, they wanted to do something, they didn't know what they wanted to do. And when we approached them and they saw the market, they jumped on board immediately.
And I know Tamara had taken herself off mute, so I want to catch her.
There I am. Yes. I'm sorry, I lost my earbuds for a minute there. Was there a question for me?
No, I was saying I saw you had taken yourself off mute to speak right before Sherry started, so I wanted to circle back around to you.
Okay. Did someone cover the point? What I had wondered about is how do we take these lessons learned? These are just great snapshots of how-tos from beginning to end of how you feed a community in crisis, how you form partnerships of, groups that sort of have the same needs, but that where their needs overlap, but you have needs and wants and desires to help and resources, and how do you connect them all together quickly in an emergency situation so that they can develop this great work like was done with the food hubs. And so I was just repeating how the Carolina Hunger Initiative was called in to help with the positioning and the getting the word out and pulling people together on child hunger to feed all that 1.5 million school kids who were going to be out of school, learning on Saturday that Monday schools were going to be closed. And one thing that I think is critical is that the Emergency Operations Center through the governor's office have some kind of cataloging, some database of these how-tos of how you can work with the community to develop these partnerships. We hear about them happening randomly over different places in the state, but they all look so different. It's one thing to have one in one city or one small town or one community, and it's another to have a whole county-wide. And it ultimately should include the funding sources for the food that are coming from our federal tax dollars. And because those nutrition programs are so underused and they're so, it's so spotty in the way that they're managed and how the rules apply. But if there were these roadmaps of how you form these partnerships so that you can talk about together and maximize the dollars that are going to be available, then I think that would just be so critical. I mean, we were just plowing new ground from the moment we started.
We had an interesting challenge, and I'm not sure I'd recommend this again, and that we had to scramble because there was this rapid turnaround grant opportunity. And so we quickly mobilized the community through some of Eleanor's partnership, and it was amazing how quickly people mobilized. And we wanted to have their partnership before we actually submitted the proposal. So then we made all these great plans, we submitted it, and then we didn't get the grant. So we felt like we can't let the community down. So that's why the funding from this group was so helpful. And by that time, I think people were really on board, kind of what Victor was saying, that people could sort of see the potential there and were willing to pull together to try to make it work.
I think it was early June when we found out, and we'd applied. It was on like April 11th or something like that. So we, there was no way that we could have sat around and waited for the funding. We would have lost all that community momentum. So we were like, I guess we'll just see what we can do. And we did it. By gosh.
One thing that I heard across both of these was the importance, right, of that community network. I think what's interesting, or not interesting, that might be the wrong use of the word, is that both teams already had anchored relationships and community relationships in place. And I think often new partnerships where they get stymied is that work to do the development of the relationship. So it feels like there's trust that's already inherent, that the work is going to be done in partnership. And I wonder, for those of you who've been working at the community level for a while, and sort of started these projects based on the relationships you already had established, if you have thoughts on how to get into a community to start developing those relationships prior to the need for reaction and response, right? Because I think often when we're trying really quickly to move, if the relationships aren't already in place, then you just sort of hit a wall. So how do you develop those relationships in advance of maybe a crisis moment?
Yeah, that's a really good question and really interesting to me. In my previous roles, I've had the privilege of working in a number of communities, and it seems to me, to that question, there are a number of groups that are forming or are formed already around the community health needs assessment that's done in communities. So like the Chatham Health Alliance, there's Healthy Carolinians in Orange County. Most counties, not all, have some work that's happening around that. And that might be a good place to think about starting, is through that group, and maybe finding out who's in the group and reaching out to one person who could be your liaison to the group. Because sometimes I find it hard, I don't know if you guys do, if I don't know at least one person in a group, to try to engage with the group in that, to your point, Meredith, in a way that there's trust and authenticity. So if I know one person at least, then I could reach out to them first, who could do some soft introductions to me to that larger group. So I share that. That might hold some value for folks.
I think one thing I found. Go for it, Tamara.
I was just going to say, I think in terms of where you start, we all have learned a lesson through this, that the 7 food banks in North Carolina are going to be tremendously go-to resources for families in need in a crisis. And I would guess that they're all getting a lot of partnerships. Of the towns are also a great place to go and to help weave together the foundation of the leadership in support of what's going on in that community. I'm just thinking of what we've seen happen in other areas. The city government has also been incredibly involved in a number of places, especially like in Durham, and Wake County Human Services has been heavily involved in Wake County. So it's a merging of the government and private partnerships to work toward this cause on making sure that the basic resource of healthy food is available in the community, and build it from there. So I think that I'm reminded that we need to always, especially that growing resource of the food banks. Now, the food banks are largely working in the donor-based community, meaning they exist and are able to do what they do because people donate dollars to them, but they also get a lot of federal funding, and the larger food banks especially get a good bit of federal funding to support. And to the extent we possibly can, we need to always tie in again to these federal dollars, because that is easier to access to be able to get the food in place. But I love the idea of having these food hubs, but yeah, I think it is critical to kind of start with some core leadership to have, like a lot of people get confused on what a church food pantry is compared to a food bank. And the food bank is the central leadership across the state. And then there are 2,700 food pantries that they serve, that they provide the food to, for instance. A lot of people just don't understand that infrastructure and how much we depend on that structure during times of crisis.
Just wanted to share some things that have been shared in the chat here. But Maureen talked about the importance of leadership, and maybe the COVID situation can prompt some structures to be established and in place so that folks can be mobilized. So those relationships are already there, and there's not as much time being spent trying to connect people together, and that's already something that's in place. Meredith shared about maybe there could be a toolkit around establishing food hubs and mobile markets based on what was learned during COVID, that could be replicated, and something that can be adapted depending on community needs and what that makes sense, or what that would look like in different settings or situations. And the importance of having a partner, a specific person who you know and can reach out to, that knows everyone, and who can connect you to the right people, because I think a lot of times that's the hit or miss, is not knowing who the person is, who's the right person who can connect me to people where I can be supportive and be helpful, and maybe not as much of a, I don't know who this person is, who's this person contacting me, I'm not going to respond to that. And then, oh, great. So there is a toolkit of sorts that Dr. Amerman has shared, and has shared the website to that. So also checking that out. Looking at time, I think I was also going to ask too, I know a lot of you have shared about the communication piece and how that's a big part of what happens when things like this are coming together. How do y'all get the word out? How do you communicate to folks, make sure that this is being shared on a broad level, especially in times of crisis? I know communication is huge and important. And I know Eleanor shared a little bit about having paper flyers and having things that are hands-on, but what are ways that you all have been able to communicate and get the word out to the right folks?
This is Victor. We have actually did the same thing. We did flyers from actually Care Connect went door to door and passed out flyers in the area. We also have a Facebook page, and we update every month the upcoming market, the date and the time that the market's going to be held and where it's going to be located. And then, of course, your partners, the coalition partners, the churches have done the same thing. They put it on their Facebook. A couple of the locations have actually bought signs and posted it out front of the site where the market's going to be held, like a day or two ahead of time. Mobile market here tomorrow at 3 o'clock or Friday at 3 o'clock. So those are the kind of things, tools that we're using to try to get the word out.
Awesome.
We used, again, relied on our partners. Cora has a text list of hundreds of people, so that we use that to notify people about the emergency food boxes available. We relied on existing blogs. Our Visitors Bureau person did a really nice weekly profile on our participating hub vendors. We had a Facebook page. So we did everything, everything that was free. It would have been great with more money to do things like radio ads, but we weren't able to do that. But we were able to do a Chatham News and Record interview, for example. And then also each week I would send, or I think it eventually switched to every other week, I would send all of our partners, which ended up being a list of like 100 to 120 people, an update to say, here's what we did this week, here's what we need from you. And that was a good way to track our progress historically, like to go back and say, okay, what was the week that we found out we didn't get that grant? But also to make sure that everybody knew what was going on, even if they were not intimately involved in project planning, to make it really clear, this is what we need from you this week, this is how you can plug in. And that was a helpful way to get people active.
Also, I think Ulani or Sherry may be able to speak about this a little bit more. I know there was a text, I think, program too that we sent out to clients and potential clients to advise them about the market. Ulani, did you?
Yeah, so it's called, I think, Easy Text. I don't know I think that's what it's called. And based on how we would do with our, for the mobile food markets, it's the people from the health assessments and the list. So that we'll just send out reminders a day or two before, and then we'll send a reminder that day through the text, and they will get that text.
Yeah, that was great. And I have to give a shout out to Yolani too, because her individual activities as a community health worker in communities the day of events, going from community member to community member, I think were key and instrumental to us being able to build that sense of trust and get people really activated there.
I love what you shared too, Eleanor, about kind of having a summary statement and having that information that is shared out too, because I think a lot of times what happens is that communication stops happening. So people don't know where we're at with the project, which I think can lead to some of that lack of trust that starts to be created. So we have 5 more minutes. Does anyone have a last pressing question that they wanted to ask while we have the folks we still have here? Okay, well, thank you all for joining us. Thank you so much to our panelists who gave of their time and energy and doing the actual work. So grateful for you all speaking with us. I hope this has provided some opportunity for folks to connect and to reach out and realize, I think it seems like Sherry Hay is one of our people who knows everybody. So making sure that you're able to connect with folks and see who knows who and connect in those ways. I'm so grateful for all of you coming and sharing with us. Thank you all for all this information you shared. I know we had someone who was in the group I was in who talked about the importance of having these numbers and this story and the context to really understand when thinking about these opportunities and the needs that are in North Carolina, especially right now during a pandemic. So thank you all so much. Dane will be following up with a survey from Qualtrics so we can get some feedback from y'all and make some tweaks and talk about things that went well. So thank you all so much, and I hope you have a great rest of your day.
Okay.